In this session, we are discussing about the muscles of mastication. I hope the muscles of mastication first session is already finished, right? So, what do you mean by mastication? What does the word stands for the chewing? Okay. Okay, fine. So, the muscles of mastication are mainly concerned with the movements of the mandible at the TMJ during the mastication process, and we divide it into two groups. We have principal muscles and accessory muscles. The principal muscles are temporalis, masseter muscle, lateral pterygoid and medial pterygoid. The accessory muscles are digastric, buccinator, mylohyoid and genohyoid muscles. In this session, we are discussing only about the principal muscle, okay. So, first we have temporalis muscle. In which region we can see the temporalis muscle? It is present in the temporal bone and also in the temporal fossa region mainly, okay. Remember this, your temporalis muscle is a fan-shaped muscle that present in the temporal fossa region, okay, and it is present below your which line? Superior temporal line and above the zygomatic arch part. So, this is your temporal bone, and from this part your superior temporal line will be present. So, your temporal muscle is present below it like this. This is a fan shaped muscle, okay. Later the tendons of your temporal muscle will run in your temporal fossa region and reach until your mandible part. So, what is the origin of temporal muscle? From which part it will originate? From the temporal fascia and also from the floor of the temporal bone, except this bone. What is this bone called? Zygomatic bone, okay. So, your temporal muscle originate from the floor of the temporal fossa, that means the temporal bone except the zygomatic bone, and it also arises from your temporal fascia part, okay. And later the tendon will run in this part and it will reach until this point. What is this point called? Coronary process. And what is this called? Condylar process, okay. So, your tendon of the temporalis muscle will inserted into coronary process of the mandible and also to the this part. What it is called? This one, anterior border of the mandible. Which is the anterior border? This one, this one. Which is the anterior border? This one. This is the anterior border of the mandible. This is the origin point of your temporal muscle, and it is supplied by which nerve? Temporal branch of the mandibular nerve. What about the action of temporal muscle? Okay, elevation, and another one, say it louder please. Side to side. Okay, side to side, lateral movement or what? Okay, your temporal muscle is mainly involved in the elevation and retraction of the mandible bone. So, how we show the elevation movement? What is this movement called? This movement is called depression. So, from this position, if your mandible comes like this is called elevation, okay. So, during the elevation, both your anterior and posterior fibers of the temporalis muscles are involved. Anterior fiber of the temporalis muscle will be pulled in which direction? In upward direction, and the posterior muscles are pulled in backward direction for the elevation action. What about the retraction? This action is called protrusion, okay. If your mandible move like this is called protrusion. If it goes back to its original position, this is called elevation, okay. So, for the elevation only for the retraction only the posterior fibers are involved. This is all about the temporalis muscle. Your temporalis muscle is also called as fan shaped muscle and it is present mainly in the temporal fossa region. What is the origin point of temporalis muscle? It originates from the floor of the temporal fossa and also from the temporal fascia part. Okay. What about the insertion? It is inserted into the coronoid process and also to the anterior border of the ramus of mandible and it is supplied by which nerve? Temporal nerve of the temporal branch of the mandibular nerve. Actions, we have major two actions, elevation and retraction. Both anterior fiber and posterior fiber are involved in elevation. Only the posterior fibers are involved in which action? Retraction. Okay. You can see here. Your temporalis muscle is a fan shaped muscle that is located in the temporal fossa region. It is covered by tough temporal fascia which is attached above to the temporal line and below to the zygomatic arch part. Origin, the whole of the muscle originates from the floor of the temporal fossa except the part formed by the zygomatic bone and it is also, that means the deep surface of the temporal fascia. It also originates from the deep surface of the temporal fascia. Insertion, the fibers converge and descend to form a tendon, a muscle tendon which passes through the gap between the zygomatic arch and the side of the skull region. So, ultimately your muscles will inserted into the coronoid process of the mandible and also to the anterior border of the ramus of the mandible. Okay. So, this is your temporalis muscle which is present below your superior temporal line and here this is the muscle tendon. It is attaching to your or inserting into your coronoid process and also to the anterior border of the ramus of the mandible. Okay. Nerve supply, the temporalis is supplied by the anterior and posterior deep branches, the deep temporal branches, that is the branch of anterior division of the mandibular nerve. Action, stop talking. The temporalis muscle elevates the mandible and so closes the mouth and approximates the teeth part. This movement requires both the upward pull of the anterior fibers and backward pull of the posterior fibers. Posterior fibers retract the mandible after it has been protruded. Okay. You can see it. This is the depression action and this is the elevation. Here both your anterior and posterior fibers are involved. Okay. Next we have protrusion and retraction. For the retraction process only the posterior fibers of temporalis muscles are involved. Next bone is masseter bone. So, how we divide the masseter bone? How many layers or parts are there? 3 parts. What are those? Superficial, intermediate or middle part and deep part. Okay. So, where your masseter muscle is present here? In this region, like this. Okay. This is the place where your masseter muscle is present and we divide it into 3 parts: superficial, middle and deep part. Okay. So, what is the origin point? Your masseter muscle is originated from the zygomatic arch part and also from the maxillary process of which bone? Zygomatic bone. So, which is the maxillary process here? So, this is your zygomatic bone, right? So, what is this part called? It is called body of the zygomatic. What is this process called? Which bone it is connecting? Frontal bone, right? So, this is called frontal process. And if you see here, this is your maxilla, right? So this is your maxillary process. And if we see back here, it will connect to your which bone? Temporal bone. So this is called temporal process. So we have three process. This is frontal process, this is temporal process, and this is maxillary process. And this is called the body of your zygomatic bone. Is it clear for everyone? So your masseter muscle originates from the maxillary process and also from the zygomatic arch part. Superficial part or superficial layer originates from the zygomatic arch and also from the maxillary process. Middle part will originate from the anterior 2/3 of zygomatic arch, inferior border. This is the inferior border and this is the superior border of your zygomatic arch. Okay. So the middle part will originate from the anterior 2/3 part. Deep part will originate from the posterior 1/3 part of the inferior border. Okay. What about the insertion? Insertion of the masseter muscle. It is inserted mainly into the ramus of the mandible, into the middle part, mainly here and also to your coronoid process. Okay. What about the nerve supply? It is supplied by masseteric nerve. And what about the action? What actions we can see from the masseter muscle? Depression, okay. Elevation, okay, fine. Any other answers? Your masseter muscle involves in the elevation of the mandible, okay, not depression. The masseter muscle is a thick quadrilateral muscle covering the lateral surface of the ramus of the mandible, including its coronoid process. The condylar process is left uncovered in this part. Origin, we have three layers or three parts, that is superficial layer, middle layer and deep layer. Superficial layer is the largest of three layers of the masseter muscle and it arises by a thick aponeurosis from the maxillary process of zygomatic bone and also from the anterior 2/3 of the inferior border of the zygomatic arch part. Middle layer arises from the lower border is nothing but again inferior border, okay, of the posterior 1/3 of the zygomatic arch. Deep layer arises from the deep surface of your zygomatic arch region. Insertion, superficial fibers pass downward and backward at 45 degree to be inserted into the angle and lower posterior half of the lateral surface of the ramus of the mandible. So, it will insert into angle of the mandible and also to the lateral surface of the mandible. So, which one is the angle of mandible here? This is called the angle of the mandible. Okay. So, lateral surface, what about the lateral surface of mandible? Which one is the lateral surface here? Okay, this is lateral surface. Is it right? Is it right? This is the lateral surface. So, what is this surface called? Is it right? Is this the lateral surface of your mandible? Is it right? This one? Yes or no? Okay. What is this surface called? Is there any name for this surface? Anterior surface. Okay. What about the medial surface then? Where is the medial surface? Where is the medial surface? Okay. So, this is the medial surface of the mandible. Is there any other surface? Lateral surface, anterior surface, medial surface. Is there any other surface in the mandible? No, only three surfaces. Sure. Osteology of mandible is finished, right? Okay, so only three surfaces. Sure, everyone? Posterior surface. So where is the posterior surface? Behind. Where? This they called it as medial surface. So where is the posterior surface then? Stop talking. How many surfaces are there in your mandible bone? Okay, 2, fine. 4 surfaces. We have seen medial surface, lateral surface, anterior surface. One more is posterior surface. So which one is the posterior surface here? This one? Okay, you can come and show me. You just explain all the 4 surfaces once.
So the mandible is divided into the ramus and the body. The body has 2 surfaces, that is the anterior or the external surface and the posterior or the internal surface. And the ramus of the mandible has again 2 surfaces. This is the lateral or the outer surface, and this one is the medial or the medial surface. This medial surface.
Is it right? Okay. Next we have middle fibers. The middle fibers pass vertically downwards and it will insert into the central part of the ramus. You can show the central part of the ramus. Yes. You just lift it up if possible. So that is the central part of your ramus where your middle fibers of the masseter muscles are inserted. Okay. Next we have deeper fibers. It will pass vertically downwards again and it will insert into the upper part of the mandibular ramus and also to the coronoid process part. So that is the coronoid process, and another one structure is upper part of the mandibular ramus. This is central part, right? So this will be the upper part.
Upper part.
Yeah, upper part. Upper part and also the coronoid process. Okay. And your masseter muscle is supplied by the masseter. Thank you. Your masseter muscle supplied by the masseteric nerve, and the only one action that we see from the masseter muscle is elevation. Okay. This is about your both temporalis and masseter muscle. Any doubts in this? No doubts? Sure everyone? Okay. You can see here, this is the masseter muscles, this is the superficial one and this is the intermediate one and this is the deep one part. Okay, deep part or layers. And here this is the origin point. It will originate from your maxillary process and also from the zygomatic arch, and it will insert into your coronoid process and mainly to the middle part of the ramus. The next one is lateral pterygoid. Lateral pterygoid is a short and thick conical muscle with its apex pointing backwards. The origins, the lateral pterygoid have 2 heads, upper head and lower head. The upper smaller head arises from the infratemporal surface and crest of the greater wing of the sphenoid bone. Can you identify the sphenoid bone? Anyone? Sphenoid bone, like in this. Can you do it? Parts of the sphenoid bone? Not sure. Okay, fine. Anybody else? Anybody else? Sphenoid bone and also its parts. Can anybody identify? Osteology is not finished? Okay, fine. So remember right now, upper head originates from the greater wing of the sphenoid bone, okay, and the lower head originates or arises from the lateral surface of the lateral pterygoid plate of the sphenoid bone, okay. I can show you the lateral pterygoid plate in this specimen particularly. For greater wing and lesser wing of the sphenoid bone, I have added the picture because there is no separate bone of sphenoid bone. Okay. So this part what you are seeing here, this part where I am keeping my finger is your sphenoid bone. Okay. And later we have to check like this. Can you see the two process here, sharp one here and here. Okay. So this is the lateral pterygoid plate of your sphenoid bone and this is the medial pterygoid plate of the sphenoid bone. Okay. From this is where your origin of the lateral pterygoid muscle takes place. This is the lateral pterygoid plate and this is the medial pterygoid plate. Okay. Next, insertion. The fibers of two heads run backwards and laterally and they will converge to form a thick tendon which is inserted into the pterygoid fovea on the front of the neck of the mandible, articular disc and capsule of the TMJ. So tell me, where is the neck of the mandible? Others, where is the neck of the mandible? Just point your pen there once. Okay. So here, right? So is this the neck of the mandible? Sure. So what is this part called? Mandibular notch. Okay. What is the significance of mandibular notch? Say it louder, please. So what is the significance of mandibular notch? Does any structures pass through this notch? Any idea about that? Which nerve? Masseter nerve. Okay, fine. Any other structure? Any other important structure? Okay, fine. So this is the neck of the mandible. The insertion of your lateral pterygoid muscle takes place at the neck of the mandible and also at the articular disc and capsule of the TMJ. So this is your temporal bone and this is your mandibular bone. So this is the place where the joint is taking place. So this is where we can see the capsule and also the articular disc of the TMJ. Okay. So here and here your lateral pterygoid muscles insertion is taking place. Okay. So where your lateral pterygoid is present? It is mainly present in your infratemporal fossa region like this. On the inner aspect like this, here it will present. Okay. So which nerve supplies to your lateral pterygoid muscle? Which nerve supplies to your lateral pterygoid muscle? Mandibular nerve. Your lateral pterygoid is supplied directly by the anterior division of the mandibular nerve. Okay. You can see here. This is the upper short head and this is the lower large head of your lateral pterygoid muscle. And this is the insertion point. This is your neck of the mandible and this is the capsule and also the articular disc of your TMJ. Okay. And origin, it will originate from the greater wing of sphenoid and also from the lateral pterygoid plate. And it is supplied directly by the anterior division of your mandibular nerve. What about the action? Side to side chewing. Okay. Any other? Okay, fine. Protrusion. Okay. So your lateral pterygoid of two sides depress the mandible and also the lateral and medial pterygoid muscles of both the sides act together to protrude the mandible and also contract alternatively to provide the side to side chewing movement. Okay. Relation. The lateral pterygoid is regarded as the key muscle of the infratemporal region because its relation provide a fair idea about the layout of the structure in this region. You can see here. So between your upper head and lower head we have a small gap. So in this gap there will be two important structure passing through. The first one is maxillary artery and the second one is buccal nerve. Okay, and these are few structure which passes or related to your upper border of the lateral pterygoid muscle. The first one is mesenteric nerve, the second one is deep temporal nerve and the last one is deep temporal arteries. The lower border is related to middle meningeal artery, inferior alveolar artery and nerve and also the lingual nerve. Okay, these are the important structures you should remember. The next one is medial pterygoid. Medial pterygoid is a thick quadrilateral muscle and it consists of two heads again. Here we call it as superficial and deep head. The origin, the small superficial head arises from the maxillary tuberosity and also from the lateral surface of the pyramidal process of the palate. Stop talking. Palatine bone. The large deep head arises from the medial surface of the lateral pterygoid plate and it is grooved surface of the pyramidal process of the palatine bone. So all you have to remember is the superficial surface arises from the maxillar tuberosity and from the palatine bone and the deep surface or deep head arises from the lateral pterygoid plate and from the palatine bone. So which is the maxillar tuberosity? This is your maxillar bone, right? This is the maxilla bone. Where we can see the maxillar tuberosity? The tuberosity of your maxillar bone is present at the posterior most region here in this part. Okay. This part is where we can see the maxillar tuberosity. Okay. What about the palatine bone? Where we can see the palatine bone? Where is the palatine bone? Okay. Which one? Anterior part or posterior part? There is division in that area. She is pointing here in this region. So where? Exactly where here? Anterior part or posterior part? Posterior part. So here. So this is your palatine bone here in this region. This is the palatine bone region. Okay. And the second, that is the large head, arises from the lateral pterygoid plate. I have already shown this is the lateral pterygoid plate and also from the palatine bone region. Okay. Insertion, the fibers run downward, backward and laterally to be inserted by a strong tendinous lamina into a roughened area on the posterior-inferior part of the medial surface and also the angle of the ramus of the mandible. We have already shown the ramus of the mandible also and medial surface of the ramus. Okay. Then nerve supply, the medial pterygoid is supplied by the nerve to medial pterygoid, a branch from the main trunk of the mandibular nerve. Remember this, nerve to medial pterygoid is a direct branch from the mandibular nerve. Okay. You can see here, this is your medial pterygoid muscle, this is the superficial head and this is the deep head. Actions. Medial pterygoid of two sides elevate the mandible to help in closing of the mouth. Acting with lateral pterygoid, the medial pterygoid helps in the protrusion of the mandible. So you have to remember elevation and protrusion. These are the few structures which is related to your medial pterygoid muscles. You can see here maxillary artery, inferior alveolar artery, inferior alveolar nerve. These three structures were related to your lateral pterygoid muscle also and also medial middle meningeal artery, buccal artery and lingual nerve. Again, these three structures were also related to your lateral pterygoid muscles. Okay. So this is the tabular column for all the origin, insertion and actions of the masseter muscle. So what you have understood by this after seeing the tabular column? For all the principal muscles, the origin points are different, but every muscle are inserting into the ramus of the mandible and also to the coronoid process part. Okay, and all muscles are supplied by mandibular nerve of the trigeminal nerve, but from the different divisions or branches. Okay, and all the muscles are involved in the movement of the mandible with respect to the temporomandibular joint. Okay. Your temporalis, masseter and medial pterygoid helps in elevation and elevation. Remember this point. MCQ question. Okay. Only the lateral pterygoid muscle is not involved in the elevation action. This will be MCQ question sometimes, so note it down. So any doubts in this? Muscles of mastication. Next we'll see two more concepts. In next session we will be discussing about the Pterygopalatine Fossa and Pterygopalatine Ganglion in detail. The Pterygopalatine Fossa is a pyramidal space situated deeply below the apex of the orbit between the pterygoid process of sphenoid behind and the perpendicular plate of palate in front region. More laterally, the back of maxilla replaces the palatine bone as the anterior boundary of the entrance of the fossa, that is called the pterygomaxillary fissure. So, in this kind of bone or in this kind of specimen, you can see only the pterygomaxillary fissure part. So, you have to answer this is the pterygomaxillary fissure. Behind to it, that is in the interior part of the skull, the pterygopalatine fossa is present. Okay. So if you observe it from a very close part, you can see a opening here in this region. Okay. This region we have a small opening that is called the pterygomaxillary fissure. It will open into your inferior orbital fissure part. Okay. And your pterygopalatine fossa is a pyramidal structure. So we have apex, base and 4 wall region. So what are those walls? Apex is directed downward here. Base is present at the upward direction. Okay. So it is basically a reversed pyramid structure and it has 4 walls: anterior, posterior, medial and lateral walls. So for next session you have to write assignments for the walls of the pterygopalatine fossa region. Okay. Okay. This is your sphenoid bone which I was talking. Okay. So this is, stop talking. The first picture is from the anterior aspect or view. The second picture is a posterior aspect or view of the sphenoid bone, and this pink structure will show where exactly your sphenoid bone is present. So basically the structures of the foramen which present in your sphenoid bone will ultimately open into your middle cranial fossa part. Okay. So this part we call it as body of the sphenoid. So this is the body and this is also the body of sphenoid. We have 2 wings in sphenoid bone, greater wing and lesser wing. This structure what you are seeing here is the greater wing and this small structure is the lesser wing. Here this is the greater wing and this is the lesser wing. Okay. I have already mentioned this is the lateral pterygoid plate and this is the medial pterygoid plate. Okay. And this opening what you are seeing between the lesser and greater wing of the sphenoid bone is called the pterygomaxillary fissure. This is the fissure what you can see in this bone. Okay. So now if I come downward, this is the territory of your pterygopalatine fossa. This is where your Pterygopalatine fossa is present. So what are the parts of sphenoid bone? We have body, two wings, greater wing and lesser wing. Okay. Between the greater and lesser wing, we have a fissure that is called pterygomaxillary fissure. This is the pterygomaxillary fissure part. Okay. So in the medial aspect of the pterygomaxillary fissure, we have a bony orbit structure. Beneath that or below that, we have a area of Pterygopalatine fossa. Okay, is it clear for everyone? Okay. In the anterior aspect, we can see three openings or foramen. What are those? This is from medial to lateral. The medial most opening is called foramen rotundum. It is called foramen rotundum, from which your maxillary nerve will pass and enter to your middle cranial fossa. And what is these two foramens are called? It is already discussed in last class. What it is called? Foramen spinosum and foramen ovale. So the first one is foramen rotundum, this one. The larger one is foramen ovale and this one is foramen spinosum. Okay, these are the three openings we see from the anterior aspect. Again, in the posterior aspect, we have three openings. Observe carefully. This is the first opening, this is the second opening, and this is the third opening. Okay, the first opening is nothing but your foramen rotundum. You have to find out the names of second and third opening. It is called canal. These are not called foramen, but those are called as canal. Find out the name of the openings or canals present in the posterior aspect of your sphenoid bone. Okay. Any doubts in this one? Any doubts in the sphenoid bone? Okay. You can see now. The first one is anterior aspect, second one is posterior aspect. Don't get confused, this is the superior orbital fissure. This opening what is present here now, this is called pterygomaxillary fissure. It will ultimately open into your superior orbital fissure part, okay. And beneath that here, this is the area of your Pterygopalatine fossa is present. Finished? Okay. This is the schematic representation of your Pterygopalatine fossa. Once I discuss in detail, I will explain this one, okay. Next we have Pterygopalatine ganglion. So what do you mean by ganglion? Collection of? Okay, fine. So what is the significance of ganglion or importance of ganglion? Okay, well, coming to next class, study the importance of ganglion, how we divide the ganglion, or what are the different types of ganglion present in our body. Then only we can start with the study of Pterygopalatine ganglion, okay. So the Pterygopalatine ganglion, which is also known as the ganglion of hay fever, is the largest parasympathetic peripheral ganglion. It serves as a relay station for the secretomotor fibers to the lacrimal gland and also mucous glands of the nose, palate, pharynx and paranasal sinuses. Topographically, it is related to the maxillary nerve, but functionally it is connected to the facial nerve through the great petrosal nerve. It is located deeply in the upper part of the Pterygopalatine fossa and it is suspended from the maxillary nerve by the two short roots. Okay. See this picture. This is a picture starting from your face to your brain part. Okay. So you have to imagine like this old part is the interior. Okay. So this is the face part and this is your brain part. So this is the midbrain, this is pons and this is medulla oblongata. From the pons we have one important nucleus that is called superior salivary nucleus. From this a nerve called superficial petrosal nerve is entering into your Pterygopalatine ganglion region. Okay. And one more branch that is called deep petrosal nerve. From the neck region it is entering into your pterygopalatine ganglion part. Okay, and one more important point you have to remember is your pterygopalatine ganglion is suspended by your maxillary nerve through two roots. These are few important and basics points you should remember. Okay, again in detail I will take it in the next class, but stop talking. Again in the next class. Before that you should know what is ganglion, what are the importance or significance of ganglion and different types of ganglion present in the body. Okay, is it clear for everyone? Any doubts? Okay, fine, we will end the class then. Thank you.